all of you have cancer, and we give you the same treatment, but your DNA is different. So for example, you guys have genotype CC, you guys CG, and you guys have GG. Now, only you guys respond to the treatment we give you. That seems a bit unfair, no? We have a lot of exciting new treatments on the market. Like for inflammatory bowel disease, which is a precursor for cancer, we have drugs that suppress your immune system. And for cancer, we have drugs that activate your immune system, called immune checkpoint inhibitors. These drugs come with far lesser side effects. And for some people, they are the magic bullet, but others don't respond at all. How great would it be if we can predict who's going to respond by looking at someone's DNA? Because it might take a doctor months to figure out the right treatment, but it only takes a few hours to figure out someone's genotype. This is the wall I want to break. In our DNA, we have a million different places where you can have just a single letter difference, also known as a SNP. Now, most are insignificant, but some have a huge effect on how our body functions and how a disease progresses. I am mainly interested in the one in the DNA for IL-6, which is a cytokine from your immune system. On this spot, you can have the letter G or the letter C, and this is known to affect your chances for many inflammatory diseases, including IBD and cancer. So to test how well this predicts responsiveness, we created mice that are exactly identical, except for just this one letter difference. First, we induced inflammation in the mice, and we saw that the C mice got more inflamed. So then we promoted inflammatory bowel disease. And not only did the C mice get sicker, measured with, amongst others, weight loss, when we gave them drugs specifically targeting IL-6, they responded better. And this is exactly what we hope to find. Now, we have strong reason to believe this will work for cancer, because when we look at patients that don't respond to treatment, this SNP comes out as a factor most influencing it. And when we isolate immune cells from the mice, we see that they behave differently between the C and the G, which could explain the why. So I'm going to repeat these experiments in mice with cancer and figure out the best treatment for the right genotype. But after this, we can use it for all sorts of inflammatory diseases. This can lay the foundation for treating people based on DNA. Then we can say that when all of you have cancer, you guys might benefit from ICI treatment, and you guys need a different kind of drug. This shortens the process for a patient in finding their magic bullet. And after this, we can even use it for all sorts of inflammatory diseases. So there's so many more walls to break. Thank you.